Hello, welcome to Complete Chiropractic Healthcare on the website of Dr. Greg Arnold, www.pitchingdoc.com. Today we're going to be discussing the concept of active recovery, July 22nd, 2017, and how active recovery can help prevent arm pain during the season. If you look below the date, there's a hyperlink for a PDF. We'll pull this up. Sometimes it's easier to read. So with the month of July, in my experience, I've seen three things happen. One is the kids are playing more games, they're playing more tournaments, and because they're playing more games, they're having less practice. And along with this, I would see a spike in the number of kids who present in my office with arm pain. So is this all coincidence? No. Okay? And what happens is this increase in game playing decreases what kids are doing between games. Namely, they are actually less active between games. They're playing 2, 3, 4 games a week. They finish playing the game, then they go home and they don't do anything, or they have other activities. They're swimming or obviously playing with their friends, but they stop doing any kind of baseball-related conditioning. And this is a big problem. Doing less between games actually increases arm problems. I have a lot of parents who come in. He's playing, 3 games a week, but in between, we're just resting. And I said, that's the reason why your son's having arm problems. So the way that we can help with these arm pain problems is we have to understand the concept of active recovery. So what is active recovery? Well, active recovery is something that's very popular with people who are avid runners. And if you click on that link, it'll pull up an article from Runner's World that talks about the concept of active recovery. And there's a difference between resting completely and what we call active rest or active recovery. And when you have a rest day, you don't do anything, okay? You don't do any training, you sleep. This is something like the day before you pitch. The day before you're supposed to pitch is a day that I recommend you don't really do anything. No throwing, no running, no medicine ball, no conditioning. Just focus on what you have to do the next day. Active recovery is where you actually do low-level exercises to help stimulate blood flow to the muscle. And it's this blood flow to the muscle that improves nutrient delivery, clears out waste from muscle damage and ligament damage from the activity, and actually helps get you ready for the next day. So for a runner, this is actually doing low intensity, maybe 20-minute runs versus their 10, 11, 12-mile runs. So if you want to be able to keep yourself healthy, it's about balancing complete rest with active recovery. And what I'm seeing with baseball players is they have too much complete rest between games. Now, an example of this is when I saw a friend of mine who, after running the Chicago Marathon, the next day I saw him at the gym and he was on the treadmill. He ran for 20 minutes, and I was kind of dumbfounded. When I asked him why he was on the treadmill the day after he had just run 26 miles, he talked about active recovery, and he talked about the need that when he does these low-level active recovery runs, he actually feels better and he recovers better. So increasing blood flow is what is needed to help recovery between games by increasing nutrient delivery and waste removal. So what does this mean for pitchers? Well, this means clearing out the lactic acid that forms from throwing and muscle damage, and also repairing the micro tears. Remember, when you throw in a game, you throw 50, 60, 70 pitches, you're having microscopic tears in your muscles, in your ligaments, in your tendons, all throughout your arm. And what you have to do between the end of the game and your next start is make sure that all of this recovery occurs. So how do you participate in this active recovery? What does it mean for a pitcher to actively recover? Well, one thing that I always tell my pitching students, which they are kind of surprised at, is they need to throw more between their pitching starts. They pitch too much, they don't throw enough. So we talk about some light level throwing, but the two other things that we encourage is we talk about weighted jump rope, and we talk about medicine ball deceleration training. And all of this is done at a very low intensity, which increases blood flow, which then leads to healing. So how do we, where can you find information on weighted jump rope and medicine ball information? It's in my video library. So if you click on that link, it'll take you to this page on my website, which describes the video library. You can subscribe, and then once you do subscribe, you have all these presentations all on the right side, and one of them is medicine ball deceleration training. And when you click on this presentation, it will start to give you videos throwing exercises to do with medicine balls, different drills, 2-knee drill, step behind drill. You click on another link on the right side, and it talks about the weighted jump rope and the importance of weighted jump rope to overall rotator cuff health. And if you click on this video in the library, it'll pull up this YouTube video of how to properly do jump rope, and then if you click on this link, it'll give you the presentation to do on how to properly do the program. So a lot of information is available on the website, on the in the video library, and it's something that is extremely important to do between games. So how do I know that active recovery works? Well, my pitching students who follow this program, they constantly tell me, my arm doesn't hurt anymore. And to me, that's proof that what we're trying to do here is helping the kids stay healthy. So if you have any questions about this newsletter, please feel free to give me a call, send me an email, or you can go to my website, www.pitchingdoc.com. Thank you.